Hey, how's it going? This is a class exercise, and we are talking about informed consent for online counseling. I have the right to withhold or withdraw consent without affecting my future career or treatment, risking the loss of withdrawal of any program or the benefits which I would also be entitled to. This is not for minors. Clinical care consultants of online psychotherapy services are not for minors. When we go through the verification, all new clients have to verify their age and identity by providing screened images and also of their driver's license or any verifiable governmental identifications. The technology we use are for therapists that will not violate HIPAA-compliant video services. The client is responsible for securing his or her own computer hardware and internet access points that also go with the password security. Our company is not liable for his or her own confidentiality. The confidentiality is not liable for the company. The company is not responsible for their client's equipment failure and also camera or internet service. The company is also not responsible for lapses in confidentiality that are in direct response to the client's actions. When going through disconnection problems, if the services are not available due to unplanned equipment or service malfunction, sessions will occur via telephone. Any risk of harm. At intake, client who reports being at risk of harm to self-other will not be offered online through psychotherapy therapists through CCC. If a client who is formerly at risk should become at risk or such of harm to self-others, they must immediately report it to their CCC therapist. If such cases become extreme, a client may be referred to a traditional non-online counseling program or provider. Some confidentiality restrictions. Laws that protect confidentiality or any other medical information also apply to psychotherapy. Information about the client will only be released with his or her expensive written permissions, with the expectations of following cases. When dealing with records, the counselor will maintain records online and also consultation services. The clinical records will be maintained as required by applicable legal and ethical standards according to various counseling professions and licensing boards. The credit card and other online payments will be made at intake, and a form of reliable payment must be established before the first session occurs. There are no late fees or no-shows. However, there are late cancellations.